we know, fortunately, and we have for about the last 20 years, so we know quite a bit about tinnitus. There was a time when I didn't have this confidence because we really didn't know what was causing tinnitus, what were the underlying mechanisms. I begin with counseling and some generic or easy to implement recommendations. And to be honest with you, the vast majority of people with bothersome tinnitus, no matter how bothered they are by the tinnitus, they usually respond pretty well to this initial management strategy.
Dr. James Hall is an audiologist and PhD researcher with a distinguished career spanning decades. He's an author, esteemed educator, and a pioneer in the field of audiology. Dr. Hall's contributions to auditory health are vast, with a particular emphasis on tinnitus and hearing disorders. He's published extensively and conducted research that has shaped our understanding of how we process sound and hearing health. Dr. Hall is renowned for his commitment to patient care, adopting a holistic approach to tackle the challenges posed by tinnitus, what we'll cover in today's podcast. We'll explore his first objectives when seeing a patient with bothersome tinnitus, actionable steps for those who are severely affected by this condition, the role of cochlear hair cells in tinnitus, common causes of the condition, and what constitutes a good outcome in tinnitus treatment. Additionally, we will touch on some commonly misunderstood cases, including those triggered by stressful life events and instances of tinnitus for individuals who have a normal hearing test. Dr. Hall, let's start off with our first question. What is your first objective when you see a patient with bothersome tinnitus?
Well, my first objective always is to give the patient hope. So I'm always upbeat, positive when I greet them, which actually may be in an email or some communication before the actual visit to the clinic. But my first goal is to give them some optimism that I know a lot about tinnitus, that the profession knows a lot about tinnitus, and that they can be helped.
When you provide that optimism, it's coming from experience that your patients are helped. So how do you portray that kind of confidence? How do you back it up with real success stories for people who speak with you about their tinnitus?
Well, that's a really good question and a good point. It's irresponsible to just say to somebody, "Don't worry, everything's going to be fine." So my optimism and my goal in giving them hope is all based on evidence. So I say, I know everyone can be helped, but we first need to find out as much as we can about your hearing and your tinnitus and any other factors that might be contributing to the problems with tinnitus that you're having. And I'll stress that we practice evidence-based audiology, and so everything we're going to be talking about today, I'm now talking the way I would with a patient. Everything we're going to be talking about, everything that I do is really based on research findings, and we know a lot about tinnitus, fortunately, and so that's why I'm able to express optimism that's professionally appropriate.
I once was in graduate school studying hearing conditions, tinnitus, hearing loss, and you were one of the authors of the textbook that I read about the little hair cells inside of the cochlea. And I wanted to ask you to please explain the delicate little hair cells inside of our hearing organ and how they can play a part in tinnitus.
Well, that's a very, very critical point. And the book that I wrote, it's about a technique called otoacoustic emissions, which is basically sounds produced by the ear, usually in response to sounds presented to the ear. And the otoacoustic emissions are arising from these delicate little hair cells inside the ear. And virtually anything that can affect a person's hearing will first affect the delicate hair cells. They're technically called outer hair cells. And the reason why it's so important to complete a thorough diagnostic assessment, which includes the otoacoustic emissions test, is to document the status of those outer hair cells. They are the very first link in hearing once the sound gets into the inner ear. And research shows that almost everybody with tinnitus of any type, whether it's bothersome or just occasional, will have some difficulty or some problems with those outer hair cells. They're very, very delicate. And if they're not functioning perfectly normally, a person might hear tinnitus. So the very first step is to evaluate the hair cells. Now, how could the hair cells possibly be damaged or not be working properly? Well, noise exposure is a really common explanation, and there may be others. There are sometimes diseases or pathologies that might affect the hair cells, and then the person's healthy again, and but they still have the hair cell problems. People, when I counsel patients who've been told there's nothing wrong with you, and you have normal hearing, there's nothing wrong with your hearing system, patients find it very comforting, the patients with bothersome tinnitus, to actually be told, well, that wasn't entirely correct. When we perform this very sensitive measure of these delicate hair cells, we did see a little problem. It's nothing to worry about, but that's where the tinnitus is coming. That's the tinnitus that you're hearing in your brain really was first generated by the malfunctioning or abnormally functioning outer hair cells. So, and that's concrete. It's something that the person can really latch onto as an explanation for why they have this tinnitus. And then the management, of course, can be much more effective.
One of the most important things for tinnitus reduction that I've found is getting connected to a specialist that can identify the root cause and provide a treatment that matches the cause. In that sense, I'd highly recommend that you check out TrebleHealth.com. My team of audiologists are specialized in tinnitus and can provide a free consultation to you to help you get started on the right path. If you'd like to learn more, head over to TrebleHealth.com or click the link above right in the screen. Even something as simple as the natural aging process, I think everyone would agree with the statement that their hearing is not what it used to be, right? No matter how old they are, I think it's pretty clear that our hearing's not what it used to be, whether that's from going to concerts, loud music, or potentially the natural aging process where these cells that process very high-pitched sounds start to decrease their physiological health over time. And there's a change there. And that change can be the catalyst for the neurological symptom of tinnitus to manifest. And like you said, it's so important to bring it back down to that root cause. And in our experience, that is one piece, or at least one contributing factor to tinnitus in a vast majority of cases, except for those who are relatively younger, who have a somatic or somatosensory based tinnitus related to their jaw or neck, or it's some sort of medical condition like Meniere's disease or medication changes. It almost always involves the cochlear hair cells, correct?
That is correct. And you mentioned the aging process. And one of the more recent developments or facts that has emerged from lots of research is that it's not so much the person's age that is responsible for the hearing loss, it's what's happened to them throughout their life. So we now know that there are what are called comorbid conditions. Diabetes is a great example. Cardiovascular disease, high blood pressure, for example, even high cholesterol, hyperbilirubinemia, or lifestyle factors like smoking or not exercising enough or poor diet. So when we're first meeting, me and the patient with bothersome tinnitus, I outline all of this in very simple terms and say, we're going to do everything we can to help you get to the point where these sounds in the ears no longer bother you. But I'm going to need their help. I'm going to enlist their help because a lot of the changes that need to be made, they will have to make. And it's usually reassuring. They're not surprised to hear that the tinnitus is related to some of these other health problems that they've probably been dealing with for some time and talking to their physician about. So now it's kind of putting the tinnitus and says, well, this is kind of like the problems I'm having with my knees or my difficulty in maintaining the proper weight. It puts it into just kind of a typical health problem that rather than something very, very scary and mysterious that they're worried about.
That's great. And I'll pass that along to my team. When our team at Treble Health are working with patients over telehealth, we make a strong dedication to identifying what we call the root cause ID. So like you were touching on, when we can identify for our patients, these are the factors that are contributing to your tinnitus. Tinnitus being a symptom, the underlying cause is potentially the hair cells of the cochlea, plus commonly stress on the central nervous system, what we might simplify as called stress-induced tinnitus. And it's often a combination of factors that lead to someone's case. And when we can target the treatment accordingly, they have the best results. So I wanted to open that up to you and ask you, what generally causes tinnitus in your experience, and what do people need to know about this important issue?
Well, as I mentioned earlier, tinnitus can be it is a symptom, and it can be a symptom of ear disease, or, as I said, some more systemic diseases or disorders like high blood pressure, for example, or high cholesterol. But let's say the person doesn't have any of those problems. They're generally healthy. Tinnitus isn't by itself ringing in the ears or buzzing, cricket sound, any kind of sound in the ears is really not an abnormal thing. Most people, if you put them in a very, very quiet place, sometimes even children, even young adults with perfectly normal hearing sensitivity, they'll still hear some sounds. And I very often tell patients I hear high pitched tinnitus. And when we started talking, Ben, I didn't hear it. Now I hear it very loudly because my whole focus is on uh, tinnitus. But tinnitus itself is not dangerous. It shouldn't really be of any concern. What happens with many people, very, very common scenario, is they have some tinnitus occasionally. Maybe when they're going to sleep at night, they hear it. Maybe after they go to a concert or they've been around loud noise, even driving down a highway at high speed. After that, they hear a little tinnitus and then they don't pay any more attention to it. And then something stressful occurs in their life. It could be the loss of a job, a death in a family, any bad news. Could be just that they're working a little more, or perhaps they're very, very tired for some reason, and now they notice the tinnitus, and and it's consistent, and they didn't really notice it before, so they assume something different has happened. But it's sort of a subclinical tinnitus, a tinnitus that was already there that's now become very, very noticeable. And if I can identify that stressful event, and we can track it down and say, so the person will say, well, no, actually, now that you mention it, I did occasionally hear tinnitus, never bothered me, but it was after that stressful event, and they identify the time frame. Then we know, well, stress is a factor. But they know this is not something new. It's not something they really, really need to be concerned about. We just need to address the stress and put this tinnitus that they were hearing in the past back to that role or that level for them. So tinnitus is by itself is not an unusual phenomenon. Most people in a quiet location will hear tinnitus. It's when it becomes a real problem for some of them, they can't ignore it, that we have to address.
One of my biggest, inspirations of meeting you and becoming your colleague and your friend here is your dedication and confidence to our patients. I've heard you say, "I will not give up until I solve this." Could you explain more about where that confidence comes from?
Yes. Well, first I'll say that many healthcare professionals, sadly, when they encounter a person with bothersome tinnitus, don't take that attitude. They basically brush them off. Surgeons often do this because they can't cut the tinnitus out. They can't operate on it. There aren't many medications that are beneficial for bothersome tinnitus, and so my confidence comes from knowledge. Knowledge is power. That's something I try to convey to patients in my counseling. We know, fortunately, and we have for about the last 20 years, so we know quite a bit about tinnitus. There was a time when I didn't have this confidence because we really didn't know what was causing tinnitus, what were the underlying mechanisms. But now we do. And my confidence also comes from seeing many thousands of patients with varying degrees of bothersome tinnitus. So it's the confidence is based on its solid foundation. It's not just to make the patient feel better. The patient with bothersome tinnitus has to trust the person who's trying to help them. They have to have total confidence in the person. And very often, what I'll do is just very quickly give them a little bit about my background. Often, a physician who is referring them to me has already done that. In fact, they've said very positive things about me, which helps as I begin to develop trust and develop my relationship with the patient. And that's a key word. I want to make sure this person knows that I'm going to do everything I can to help them, that I have the skills and the knowledge to help them. And I will tell them point blank. I'll look them in the eye right at the very beginning and say, now that you've come to see me, you're my patient, and I will do everything I can to make sure we get this tinnitus to the point where it doesn't bother you. And I'm confident we can achieve that goal.
So, Dr. Hall, if someone has tinnitus that's really bothering them, which is a lot of our listeners here, what can they do about it from your perspective? What is the advice that applies to most people?
Sure. Well, first, I would say go to a professional, and audiologists are not physicians, but we're hearing experts. We are experts in the non medical assessment and management of hearing and hearing related problems, which includes tinnitus. Now, if the person first goes to an ear, nose, and throat doctor, that's not a bad thing, although they do need to get to an audiologist. But the otolaryngologist typically will rule out ear disease and other health problems that might have tinnitus as a symptom. And the audiologist would probably do that later anyway. So the entry point for help for tinnitus, the best entry point is an audiologist with some expertise in tinnitus. But an ear, nose, and throat doctor, if that's where the person first goes, is not a bad first step, as long as the next step is an audiologist who has some experience in working with people who have bothersome tinnitus.
And when I see a patient who comes to me in that regard, my approach would be identifying what's the root cause of this condition here, because not all tinnitus is from the same cause. And in most cases, tinnitus is a symptom of something going on underneath. That's very important to mention. And then providing different treatment paths, often a solution that involves the best of what we call sound therapy, as well as cognitive therapies as well, potentially also some mindfulness or guided breathing to calm the central nervous system. So all three of those pieces come together and it leads towards improvement. Dr. Hall, how do you approach the expectations of someone who's going through a treatment program like the one I mentioned? What's the timeline? What can they expect?
Well, you mentioned something a moment ago that is very important, so I'm going to reiterate that statement. Tinnitus is not a disease. It's a symptom. It's a symptom of something else. And so my first goal as an audiologist is to complete a diagnostic assessment to try to identify the root cause, the reason for why this person has tinnitus. Now, if you take 100 people with bothersome tinnitus, well over 90 of them, probably over 95 of them, have no disease, no pathology. They don't need medicine. Their health is not being threatened. They have some problems with their ears, which might be related to noise exposure, might be related to the aging process, or maybe some other problem, diabetes, something like that. But it's not anything that they need to worry about. So the diagnosis and finding out why does this person have tinnitus is the very first step in management. And the management is much more effective if the person has been counseled about why they have the tinnitus. Once you understand a little bit about why you have a problem, it's much more manageable. Now, different people have different outlooks toward tinnitus, and I have to judge at the beginning whether the person's coming to me with no preconceived ideas as to what might be causing the tinnitus. If so, I'll first conduct the assessment. You mentioned sound therapy, which is basically to minimize the person's ability to hear the tinnitus or perception of tinnitus. And there are some other strategies, just general strategies to help the person sleep better, get more restful sleep, and sometimes certain substances that they can easily buy over the counter might help with the sleep and perhaps even minimize their ability to or perception of the tinnitus. So my approach is it's kind of a progressive management approach, is to provide the most effective management I can, but the least management that the patient needs. In other words, I don't start with a long, extensive management strategy. I begin with counseling and some generic or easy to implement recommendations. And to be honest with you, the vast majority of people with bothersome tinnitus, no matter how bothered they are by the tinnitus. They usually respond pretty well to this initial management strategy.
In regards to how to get better with tinnitus, one thing that we launched at Treble Health is the Tinnitus 180 program. And it focuses on 3 pillars: the root cause ID, smart sound devices, and the brain retraining program. And we put this comprehensive program together to help individuals turn their life around 180 degrees and find lasting relief for tinnitus. If you'd like to learn more about Tinnitus 180 and our approach at Treble Health, click the link above on the screen. Now let's get back to our podcast with Dr. James Hall. And what's your approach to identifying somatic or somatosensory based tinnitus?
Yeah, that is very important to differentiate right at the outset. When you first encounter someone with tinnitus, whether or not it's the more chronic, sometimes called subjective tinnitus, tinnitus that the person's actually hearing it, it's real sound, but it's not being produced by any movement or anything in the body. So the somatic tinnitus, or tinnitus that is being caused by something happening in the body, might be related to a problem with the little tube that goes from the ear up to or down to the mouth, back and forth. It might be temporomandibular joint problem. It may be a little tension in the muscles they're tiny little. The smallest muscles in the body, in fact, are inside the ear, just behind the eardrum. It could be blood flow rushing through the veins and arteries that are near the ear. Those are all bodily sounds that the person's actually hearing. Their body is producing a sound that they're hearing like they'd hear any other sound. Those problems are almost always best managed by an ear, nose, and throat doctor rather than the audiologist. So that would that kind of pattern or profile in a person would prompt me to refer the person to an ear, nose, and throat doctor, and then they'd come back and we could address their perception of that tinnitus over the long term. Those are actually quite rare, so they don't occur too often, but we have to be aware that they might, the somatic causes or bodily causes for the perception of tinnitus, they can occur, so we always are keeping an eye open for them.
Thank you, Jay. I want to discuss what is considered a good outcome in tinnitus treatment. So the way that I normally approach this, when someone talks to me in a telehealth consultation, for example, and they discuss their case and they say, Dr. Ben, my tinnitus is really bothering me. I have a hard time sleeping. I can't concentrate when I'm trying to work or in a quiet place. I occasionally have a hard time hearing, and my tinnitus is constant. It's a 6 out of 10. So generally speaking, what I would consider a good outcome there is to take that 6 out of 10, which is a subjective rating of 1 being not a problem at all. I rarely hear it. 10 being it's a severe problem. It's one of the worst health problems I've ever had. It's constant, it's persistent, it's affecting a lot of areas of my life. This person says a 6 out of 10. I've seen many good outcomes in the bringing that 6 out of 10 down to a 2 or a 3 out of 10. So I would consider that a good outcome. And for someone to hear that who hasn't gone through it, the next logical question is, so is the volume softer, or do you just want me to ignore it? And I want to address that head on, because this isn't just a distraction technique or teaching someone how to ignore it, but the way that the brain works through this cognitive process called habituation is that the tinnitus sound can go from the foreground into the background. And the way I like to measure this is by understanding what percentage of waking hours is someone impacted by tinnitus. If it was a 6 out of 10, it's for people who need help and come to us. It's often 80% of waking hours they're aware of it, right? And if the tinnitus overall impact is brought down to a 2 or a 3 out of 10, they're often saying things like, I hear it less than 20% of waking hours. Does the volume change? Often, yes, but not in all cases. And that's the fascinating thing, is that even for people who reduce the awareness significantly, but the volume doesn't change that much, they're still reporting, my life is different. Tinnitus impacts me much less, and I'm feeling healthier and happier back to where I was. Dr. Hall, what are your thoughts on a good outcome in terms of tinnitus treatment, and how do you manage those expectations?
Well, you've hit upon all of the really important points when it comes to outcome. Number one, my goal is for the person's quality of life to improve. And for the problems that they cited as the ones that really, really were the most concerning to them, for example, difficulty sleeping, concentrating, as you said, enjoying their life, in being able to participate socially as they used to. When they return to essentially their normal day-to-day activities, their normal, the quality of life that they had before they were first noticed as bothersome tinnitus, to me, that's a success. I'm not striving to eliminate any perception of tinnitus at any time during the day, forever and ever. So as you say, with most people, they'll get to the point and say, if I hear the tinnitus a little bit before I go to sleep, but then I fall asleep and I get a good night's sleep. If I hear it after I've been driving at a high speed on down the highway, or if I hear the tinnitus a little bit when I'm really, really tired, I know it's not going to bother me because I've got these strategies that I've learned to address the tinnitus. As you mentioned, the habituation, just kind of getting used to hearing the tinnitus, getting the brain to stop focusing on the tinnitus. So it's not the loudness of the tinnitus so much or the severity of tinnitus, it's how the person is responding to the tinnitus when they hear it that's most important. So honestly, with all the patients I've dealt with, one way or the other, and very often the management's quite simple. We can get the person to the point where they say, we've measured we've used an inventory, we've asked them to rate the tinnitus on a 10-point scale, and we're at that point where they say, this is really not bothering me anymore. I don't need to see you again, and my life is back to where it should be. And my family and everyone that I interact with have come to the same conclusion. Their quality of life has improved. So that's always an achievable goal for every person who has tinnitus. And it can sometimes happen within the first session. And sometimes it may take weeks or perhaps in unusual occasions, months. But it's always an achievable goal.
That's really important. And I know the way that our minds work, for some of us who are listening, they go, Dr. Hall, that sounds great, but you don't know my story. You don't know what I've been through. That can't work for me. I've tried everything. Usually, you haven't tried everything. Usually, there's an opportunity to set up some tools and follow a system that you can commit to and do well. We can't, of course, guarantee that for everyone, but I just wanted to address that it's totally normal to think this will take too long, this won't work well enough, this won't work for me. I feel like I've tried everything. Those are common things that we hear all the time. So my recommendation would be to remain open-minded that there is something or someone that can help you with this, because that's a necessary step in order to potentially get that help. Dr. James Hall, been a pleasure. I hope to speak with you again quite soon. And I wanted to ask you if you had any final words here for our audience, as well as a way for people to follow your work or connect more deeply with your contributions, whether that be research-based or as a professor.
Sure. Well, as you were speaking toward the end, Ben, one term popped into my head, that was cognitive behavioral therapy, which we haven't touched upon. But for the person who needs some help developing a positive attitude and an optimistic approach to tinnitus, cognitive behavioral therapy is one of the most evidence-based approaches. So people should be very open-minded about that. Well, I have a website that I encourage people to go to. I'm developing some YouTube videos on some certain topics. If you Google my full name, including the third at the end, you'll come across many of my PowerPoint presentations, many narrated PowerPoint presentations and articles. And I'll just conclude by saying I've been totally committed, of course, to audiology in general, but also to helping people with bothersome tinnitus, because there's no reason anyone has to go through life day after day unhappy because of tinnitus. Everyone can be helped and everyone should be helped.
Dr. James Hall III, thank you so much. Thanks for listening to today's podcast. I'm Dr. Ben Thompson, founder of Treble Health. If you need help for tinnitus and are looking for an effective solution, please reach out to our team. Head over to treblehealth.com or click the link on the screen right now, and we'll get you started with a free discovery call to help you on your path towards lasting tinnitus treatment.